All right, the clavicle bone, or your collarbone. So there's not that many structures to learn on the actual clavicle. Typically students think that the hardest part of the clavicle is siding it. So we'll go over the structures and then I'll show you a quick, easy way to side it. So the first thing you need to know are the two different sides or ends of the clavicle. So this end over here, you can see that this end is kind of flat. So see, I'm like kind of pinching it in between my thumb and my second finger, and it's more flattened, versus this end over here, this end is more round. So if I kind of turn it, you can see that this is round versus this end is more flat. So the round end, this end, is gonna be your sternal end, and it articulates with the sternum, the manubrium of the sternum. And then your acromial end is gonna be lateral, and it attaches to the acromion process of the scapula. So sternal end or medial end, and then acromion or lateral end. All right, next thing you need to notice is that the superior surface is nice and smooth. See this? So feel on yourself. You can palpate your clavicle on yourself, and you don't really feel much on top of it, right? It's just kind of some fascia and skin. And if you kind of push on your skin, you see that it's nice and movable. There's not really much attaching to the top. And so there's not gonna be any tubercles or indentations or really anything on the superficial or superior surface of the clavicle, because nothing's really attaching there. Whereas if I flip it over, this is the inferior surface, and you've got an impression here, a line here, a bump here. So notice that the inferior surface has lots of stuff on it. So for orientation purposes, the flat side is lateral, the round side is medial, and then superior is gonna be smooth, inferior is gonna have the bumps. Okay, so moving on to different structures. So on the inferior surface, over here by your sternal end, there is this little kind of, almost like a little thumbprint area, so I can stick my thumb on it right there. This here is the impression for the costoclavicular ligament. So the costoclavicular ligament, costo referring to the costals, which are your ribs, and clavicular. So you can assume that the costoclavicular ligament is going to attach a rib with your clavicle. And in this case, it's your first rib. And if you've looked at an articulated skeleton, you've seen that the first rib, it's really short and kind of curved like this. And so it's only located very medially. So if you're confused about the different structures, remember that the impression for the costoclavicular ligament is always going to be medial, because your first rib only comes out about this far from the sternum. It's not going to be all the way over here by your shoulder. So this is the impression for the costoclavicular ligament. This is where that ligament actually attaches to the clavicle and holds it down and kind of attaches it to the first rib. Creates that little impression there. Moving more lateral, you have this little groove right here, and this is mid-shaft on the clavicle. There's this small groove here, and this is the groove for the subclavius muscle, also called your subclavian groove. And so there's this little muscle, subclavius, so just by the name, you know it's gonna be sub or under the clavius, which is referring to the clavicle. So subclavius sits right about here, and where it attaches to the clavicle, it creates this tiny little groove here. And that's always going to be mid-shaft, which is helpful for orientation purposes. Now moving all the way to the lateral end, you're going to have a few different structures. So first thing to notice is this big bump right here. This bump is your conoid tubercle. And the conoid tubercle is going to be the attachment for some of the shoulder ligaments, which is why this bump is so prominent here. So it's the attachment for the conoid ligament, which hence the name conoid tubercle. Then just next to that, you're gonna have this little line here. This here is your trapezoid line, and it's the attachment for the trapezoid ligament. So the trapezoid ligament goes to the trapezoid line, and the conoid ligament goes to the conoid tubercle here. And these, again, are on your acromial end or the lateral end. So that's really all the structures on the clavicle. The only thing left is to side it. So we already know medial versus lateral. Remember, medial is going to be that rounded sternal end. Notice here it's nice and round. Lateral is going to be that nice flattened acromial end. superior versus inferior, you have smooth part is going to be superior because nothing's really attaching there, versus inferior, it's going to have the nice impressions and bumps and things. So it could sit like this on you, or it could sit like this on you, right? If we only had those two things to orient by. But I think the most helpful thing to remember when trying to orient the clavicle is the conoid tubercle. So the conoid tubercle, it's generally one of the easiest things to see on the clavicle because it's so prominent. It's not like a little shallow groove like the subclavian groove. It's typically a nice, pretty big bump. And this bump is always going to be inferior, like we've said, but it's always going to point posteriorly. So if I sit this like this, my finger's still on the bump. So the conoid tubercle is now inferior and posterior if you're orienting on yourself. If you tried to sit it this way, the conoid tubercle is here. So it's still inferior, but now it's pointing anteriorly, and that's wrong. So medial versus lateral. Superior is smooth, inferior has the bumps and the grooves, and then lastly, the conoid tubercle is always going to point inferiorly and posteriorly. So this clavicle has to be a left. If we take our other clavicle here, so this one, you have the rounded end and you have the flat end. So this end has to be medial, the flat end has to be lateral, but here, look, this is your conoid tubercle, the nice big prominent thing. And if I hold it like this, like it was a left, it's pointing anteriorly, so that's wrong. It has to be a right. So the conoid tubercle is now posterior and inferior, and so this is a right, and this one here is a left.